Well, welcome everyone. I'm Dr. Isabelle Amigues, your friendly rheumatologist and host of the UnabridgedMD podcast. Today, I am so excited to have Ren with us. And Ren is both a patient and also someone that is very inspiring. Is gonna tell us all about what she has been able to do in our community, really. So Ren, thank you so much for being here.
Thank you so much for having me.
And
I'm so happy to be here.
Love you. Love what you do. I'm
The
so
feeling's
excited.
mutual.
Yeah,
So.
thank you. So, so you maybe do you want to tell your story a little bit? Like, why don't you share with us your story?
Yeah, okay, so I think I had always been aware of autoimmune disorders. My mom had stage 4 lupus growing up, and so it was always something that was kind of like looming over my sister and I. We got the HLA-B27 diagnosis pretty young, or the test back positive pretty young. And so it was always kind of something in the back of our minds, but it wasn't until in February of 2022 when I slipped on ice and destroyed my entire left ankle and elbow that all these pieces kind of really started getting put together. Like, I had some small symptoms, but after that injury, after 3 surgeries, after being bedridden, and then after catching COVID, it kind of all spiraled out of control. And it took 2 years probably to really get a good diagnosis and handle on all the things that were kicking around genetically. So, but a huge part of that was thanks to you and finding you,
you.
Which is, I think, the first rheumatologist who really took me seriously and wasn't just like, oh, your mom has lupus, so you must have lupus. The test came back negative, so come back when it's worse.
What changed? What do you think is why do you think it worked?
Finding you?
Yeah, like whatever we're doing. What do you think? What's the difference? So basically, my question, I guess, is what made you think there has to be a different way?
It was really after, there was one study that I found, because, like a lot of rheumatology patients, you have to do a lot of self-research and really come prepared. And there was one study that instead of rheumatologists thinking that I was going to be like my mom, like I was going to have lupus, that I think the study showed kids of people with autoimmune disorders are more likely to have a autoimmune disorder, not the same one.
Yeah.
And so I was like, I need to find someone who's going to actually dig in and figure out what's going on and not just assume I'm going to keep testing positive for Anna when I'm not.
Mm-hmm. Yeah. And you know what's so exciting to me is I wish you know those pictures before and after.
Yeah.
I wish we could take a picture of the energy level and just the mindset of our patients, like how they come in and how they are after, several months. I want to say several months. Sometimes it's very soon, but sometimes it takes several months. And because your vitality, your energy level, you're just a different person.
I feel like a different person. Mm-hmm. And it's so hard with chronic conditions, especially when you don't know what's going on, to not fall into a pretty serious depression a lot of the times. If you're just feeling like crap all the time and there's no solutions, there's no path forward, there's no answers, then you're just spinning your wheels, and that is going to cause a big depression for some people. Mm-hmm. And I think together with solutions and answers and medications, I have been able to make lifestyle changes that has improved my mental health. And so it's all just coming together.
Yeah, I love that. And so, this is my favorite thing. As a physician, this is probably my favorite thing to see and to experience, because I experienced it through you, right? Mm-hmm. And so now the part where you are such an inspiring person. So you basically have enough energy And I remember when you said that, you're like, yep, I've got enough energy that not only you work, but you're actually volunteering.
Yes. Yeah.
And so I want you to tell us about your volunteer work, because it's such an important work.
Yeah. So I was a community organizer since like 2019, I think I want to say. Maybe a little bit like 2016, but I like fully dove into organizing in 2019. I was actually a like paid organizer on a couple of campaigns, and then with the injury and then everything that happened afterwards, I fully stepped away, where I didn't pay attention to any kind of organizing for a while. And part of that was depression, part of it was overwhelm. But in November, I started feeling well enough that I was like, I'm going to get back into, I joined Denver DSA, which is the Democratic Socialists of America. And I noticed that I was going to start slow, because I have a tendency to just jump right into things. And like, so we're still working on that. But I noticed that their healthcare committee was dormant. And I'm like, we just had a massive pandemic. People are dealing with a lot of complications from that, in addition to just general chronic
Anxiety
illnesses and stuff. And with this administration's threats to a lot of like Medicare and Medicaid, we're gonna have a problem of a lot of people not having access to healthcare. So this seems like a really prescient time for us to still have a healthcare committee. And so I found a couple people in the chapter that wanted to restart it. So we did. And we decided to focus on, I have 2 babies of like working groups in the committee, and one is patient advocacy. And that one's really important to me, because so much of this relies on kind of patients learning how to do it themselves, doing a lot of research themselves, learning how to build a collaborative relationship with a provider who's going to want that back. And so there's a lot of like learned experience there, that a lot of like having a chronic illness is basically a full-time job, not only figuring out how to take care of yourself, like how to eat healthy and like work out and stuff like that, but also how to do the research themselves and like put the time in to find a doctor who is going to listen to them.
Yeah.
So our like working group's goal is to consolidate a lot of this learned experience and put it into a format where like we can empower and educate patients on this. Maybe take some of the labor out of it for future patients and be like, here are all the things that we've learned collectively. Here is the best way to go about doing it. And then the other one that's really important to me is mutual aid, because I think we have gotten so far away from community and collaboration that like we need to know how to take care of ourselves. And when we have a bunch of hands helping, the work is lighter.
Yes.
And so right now we're putting together a People's Pride event, which is a alternative to corporate pride. We're going to have food and fun. And one of my like excitements about it is that we're also going to have a healthcare clinic. So we're going to have patient advocacy resources specifically tailored to queer patients.
Nice.
And how to stay safe at Pride. Our mutual aid working group is doing fentanyl testing strips, Narcan demonstrations, and, you know, safe sex.
I love that.
So.
I love that. Wow. Like, so right at November, we are in June. That was fast.
Yeah, it was.
You're already creating an event. Like, how much energy does that take, right?
A lot.
Yeah.
I think, DSA, I put in about 15 to 20 hours a week. But I love it.
It's like a part-time job, like a pretty
really
significant part-time job. Yeah.
Yeah.
What's so inspiring to me is the fact that the moment you had the energy, you're giving back to the community.
Yeah, I suppose that's true.
That's true. No, that is true. I mean, it probably gives you energy also, right?
Yeah.
And it's pretty impressive. Like, people have a tendency to sometimes to just, recroqueviller in French. That's an interesting name. But it's like just, get back into it. Recroqueviller. It's very interesting. It's get back into a ball and just, taking care of ourselves as if you're inside a shell. You're getting back into your shell. And no, you're like, no, I'm getting my gift to the world. I'm feeling better. I'm sharing.
Yeah. I think, how do I want to say that? Because it is accurate. I think it's just really important. Like, I think an instinct and sure, there are also days that I need to just like cocoon in my bed with the lights off and like put my phone on do not disturb and just be like, this is me time.
Totally.
I don't know. I think that's just the beauty of community is that like when you are putting work into the community, you're also receiving things back. You're building stronger connections, and that helps you feel more secure.
Yeah.
When like, because it's about like that security and like reserve of resources and energy that like I guess it is a little counterintuitive, but like when you do put yourself out there and realize that like people will have your back, it creates that sense of like security and bonding, so you don't feel the need to like cocoon.
I love that. Absolutely love that. What are your dreams for this committee or your vision? I think more than dreams, what's your vision?
It's hard to say. So much of how we've built this committee has been like together that I don't necessarily want to like dream for it.
Yeah,
I know specifically we're working now with Dasher, which is Denver Action Street Health Response Team. They're one of the creators of the STAR program, which is the alternative to calling 911. And I really...
Can you talk to us about STAR program? I don't think I know the STAR program.
Yeah, okay. So the STAR program
you just lit up.
an initiative that was started here in Denver. I think before 2020, but it like increased in support during 2020 during all the protests and riots against police because of how often they respond to situations with weapons, violence. Yeah. And so they came together with a couple organizations to create this alternative response where if someone is in crisis, having a mental health crisis, if there isn't like active violence going on, then what is an alternative we can bring to the scene that is less likely to end in violence? So
wow. So what does that work? Like you call what number do you call? It's not 911.
I think you can still call 911. I should really know this.
That's okay. So you call a number, maybe 911.
Yeah.
And then
I think you can call 911 and to the dispatcher say I'd like
STAR. Sweet.
Yeah.
Okay. And then who comes?
So STAR has its own response team. So they have medics and EMTs. They have trained mental health
this is amazing.
Providers. Yeah, community service coordinators.
Wow, okay. And so this is so, I love it. I think that's, oh man. You know what it reminds me? It reminds me of that say from Margaret Meadow, who says, like, don't underestimate the power that a small group will have to change things, like something like that. I'm not doing it justice, but I think that I've never seen the power of community as strong as in this country. And it is really phenomenal to see what can be done, right?
Yeah.
It's like literally, we have a problem. Here's a solution we're going to work towards, and we're going to constantly improve that solution, right? And so I fully agree. Like the vast majority of I don't want to say crime, but issues that could be in the street are from mental health issues because we don't have the money.
Or just insecurity and desperation.
Yeah.
Like if you get rid of all your stability, like any access to wealth, any access to safe housing, and like knowing that you're going to get food, like you'd probably have a mental health condition too. Like that it just happens.
Absolutely.
Like it's
Absolutely.
part of that desperation and survival.
Absolutely.
America is such an interesting country because on one hand we do have such amazing strength in our community organizations, in our community organizers and stuff, but we also uphold a system that creates these injustices that necessitate response.
But you're doing it, and that's what's so wonderful. And I think that's why I love America so much. And I'm so honored to be, a member of this, this country. It's this idea that we may not change the whole country, we may not change the whole world, but we're going to take it on us to change us and our community. And that's so huge, because if everyone were to think like that, we would change the world, right? We don't have to change the world at once, but one community at a time. So I had stopped you because I'm so excited about the STAR program. No, seriously, like I can see in some situation where I don't call 911, but it's nice to know that there's another option than to call the cops, like, right? Like that's,
In the description of the podcast, we'll include more information on how you can contact the STAR program.
Yes, we will do that. Absolutely. Thank you for sharing that. It should be my job.
No, you're good.
You're not your own. I love that. So you were starting to talk about a program that you're creating yourself.
Oh, that we're working with. So we're working with Dasher. And I'm really, there's another, QCert, I think they're now rebranding as Weavers, have you heard of the transcontinental pipeline?
No.
So it is a program to help trans patients in states where access to gender affirming care is being threatened. It helps them relocate to a safer state. And Colorado is like a really safe state for trans rights. And they're also a great local organization that once trans patients get here, they help them settle and find stability in their new home. And they also have a medic program. So what I would really like to see from at least the mutual aid working group is having, like, DSA is such a big organization, like having a solid stream of people who want to do work like that, like doing street medic stuff, helping them get funneled into Dasher and QCert/Weavers, and just strengthen programs that have already been doing this. Like, we don't want to reinvent the wheel. We want to help provide resources and support to organizations that have already been doing this for years.
I love that. Yeah, and that's exactly it. Don't reinvent the wheel. Like, I love that. Ren, is there anything that you would want to add about all of the things that you're creating with the help of your community in a community fashion? Like, is there anything you want to share?
I think I want to say, if anyone listening to this is interested in joining some of this work, or if you've been listening and you're like, oh, those are great ideas, but like the healthcare committee should really be focusing on like this other project that I want to do, come join us and we will make it happen. So
I love that.
You can find your local, you know what? I'll put the links in the description.
I love this.
For the website, for the local DSA chapter.
Yeah, I love this. Ren, thank you so much for coming, for sharing your journey, for sharing all of the work that you're doing. Thank you for the work that you're doing. I'm so excited about it. And then, if it's on June 21st.
Yeah, June 21st is People's Pride. We also are going to be doing some Stop the Bleed trainings in the community. So
love that.
You'll be able to see that on our DSA calendar.
Come to Cheeseman Park, right?
And come to Cheeseman Park, June 21st.
21st. Okay.
Yeah, from like noon to 5, we'll be there.
Okay. Is it in the, how do you call that? There's this beautiful
The
sort of
like
antique.
amphitheater
Yeah.
type situation. No, we're gonna be probably off to the side of it.
Okay, sweet.
Yeah.
Okay, perfect.
But you'll see some tents. You'll see people having a good
Exactly.
time.
Oh man, yeah. Everyone, if you are listening to this, go and join Ren and go and join the community, and then you can meet them in at Cheeseman Park from until 5 p.m. You said, right?
Yeah, from like noon to 5.
Noon to 5.
We're gonna
Okay, cool.
have food.
We can party.
There's gonna be a pie baking contest. We're gonna teach people how to
that's
vogue.
the best.
And then we're gonna have a little bit of a kiki.
I love
and
that.
We'll also do some self-defense training for anyone who's like,
Good.
wants interested in that.
All right, wonderful. Thank you.
Awesome.
And for anyone for all of you guys that are here all the way to the end, if you're listening to this, that means that you have enjoyed it. So please share it with someone that you think will enjoy this episode as well. And then we will see you next week. And as always, if you're looking for a rheumatologist, I would love to take care of you. And thank you, Ren. And I'll see you next week. Thank you so much. Bye.